Hello students. So today's question was a 15-year-old boy presenting with pain and swelling in the right knee. His radiographic image and photomicrograph of the biopsy was given, a very classical radiograph and a very classical photomicrograph. So the correct answer is osteosarcoma. Bone tumors is a very lengthy topic covering bone forming tumors, cartilage forming tumors, giant cell tumor, Ewing's and metastatic tumors. So I'll take a full video on bone tumors maybe after the 75 days challenge. आज के लिए हम सिर्फ ऑस्टियोसार्कोमा पढ़ेंगे. एपिफाइसिस, मेटाफाइसिस, डायफाइसिस, कहाँ कौन सा ट्यूमर लोकेटेड है, इस स्क्रीन का आप एक स्क्रीनशॉट ले लीजिए. ये आपको एग्जाम में वाइवा के पहले बहुत काम आएगा. सो एज यू कैन सी, ऑस्टियोसार्कोमा इज अ मेटाफाइशियल ट्यूमर. It is the most common primary malignant tumor of the bone. There is a bimodal peak age distribution. The first peak is before 20 years of age and the other peak is in older adults where there are predisposing factors like Paget's disease, bone infarcts and prior irradiation. Men slightly more than female. It arises in the metaphyseal region near the knee. So, distal end of femur and proximal end of tibia are the most common involved long bones in this tumor. It presents with pain and pathological fractures. Radiographically, there are both lytic as well as blastic masses. The most important or the most characteristic feature is the reactive periosteal bone formation and the triangular shadow between the cortex and the raised periosteal ends is known as Codman's triangle. The significance is that it indicates an aggressive tumor. So in this picture you can see that there is a triangle formed between the cortex, this is the tumor, and this is the raised periosteum. So this is known as the Codman's triangle. This is often asked in your viva. Pathogenesis, it occurs during the adolescent growth spurt, so it occurs in the growth plate of the rapidly growing bones. Then there are certain genetic abnormalities. Most important in them are the mutations involving the RB gene, TP53, which in individuals with Li-Fraumeni syndrome, the CDKN2A and MDM2 and CDK4. Morphology, grossly they are bulky, gritty, tan to grey white tumors. They can have hemorrhagic or cystic areas. The tumor, it frequently destroys the surrounding cortices to produce soft tissue masses which spread extensively in the medullary canal and they may replace the hematopoietic marrow. So this is how it looks like grossly. Then microscopically there are large pleomorphic hypochromatic nuclei with bizarre tumor giant cells and abundant mitosis. There can be extensive necrosis and intravascular invasion is also common. But for diagnosis, what we require is the presence of unmineralized osteoid or unmineralized bone and malignant tumor cells. So this is diagnostic feature. Malignant tumor cells along with unmineralized osteoid or unmineralized bone, which is typically fine and lace-like. These are keywords. Your answer must have these keywords. Unmineralized osteoid, fine and lace-like unmineralized bone. So this is how it looks like. These are the tumor cells. Here you can appreciate the pleomorphic hypochromatic tumor cells and this is the osteoid form. This is diagnostic. Clinical features, all osteosarcoma patients are assumed to have occult metastasis at the time of diagnosis. So the treatment generally it includes the neoadjuvant chemotherapy, surgery and post-op adjuvant chemotherapy. The patients who do not have meds, the 5-year survival is approximately 70%. But those who have metastasis at the time of diagnosis, the prognosis remains guarded. It metastasizes hematogenously to lungs, bones and other sites. Thank you so much.